Welcome back. I hope you are eager to know more and learn more about cancer. Now, again, sitasahau kuwakumbusha, you need a building. DreamWorks Investment Limited Company, they are here for you from the beginning to the end. Yani, they give you the plan, they give you the design, and after, they will give you the perfect interior design, and not just residential. Do you have an office? They are the people you need to make a call to. Now, the contact is just below there. Now, let's head back. The important part, fertility. Can you tell us how this cancer affects the fertility system of a woman?
Okay, cancer and fertility. Mostly what affects fertility in cancer, it's the treatment that is geared towards the cancer treatment.
Okay.
Because most of the treatments will destroy or will render women infertile.
Okay.
But that does not mean every treatment will be rendered infertile, because some will retain their fertility.
Okay.
However, in some types of cancers like ovarian cancer, breast cancer, where even after treatment and it was a hormonal positive breast cancer, for example, we wouldn't really encourage women to get pregnant, because when now you get pregnant, the hormones shoot over the roof, and now they increase the chances of having a recurrence of that cancer. Yes, but sometimes, at least in the era we live in, there's some improvement or some technologies where we are able to harvest the egg, the ova, before commencement of treatment.
The treatment.
Yes.
Okay.
And if now it reaches a point that you're completely through with your treatment and you're given a clean bill of health, you can then be, you can now get pregnant with the cryopreserved ova. Or alternatively, there's surrogacy. You can choose to have someone carry your. Yes, because the genetics are yours, the egg is yours. So surrogacy is also an option.
An option.
Yes.
Surrogacy in Kenya is a very sensitive topic, because kupata mtu atakubebea mtoto na asikuwe ni wake becomes a challenge here and there.
Yes.
But before now we go to that, now the nutrition. Kuna specific diet mtu anafaa maintain ama anything?
That is something I've been fighting for, especially there's the diet that you can eat to prevent development of cancer, which is the opposite of what we talked about. Just basically a healthy diet that is high in fruits and vegetables and non-refined carbohydrates. That's to say things like loma, ngwashe, legumes kama mbosho, dengu, vitu natural. I've said fruit and vegetables, and less of refined animal proteins like sausages, bacon, so less of that. But now I've had a problem with patients after they have been diagnosed with cancer, and now they are undergoing treatment. But there are so many stories that don't eat this, don't eat that, don't eat proteins. But then I want every cancer patient to know, as long as you're undergoing the treatment for cancer, you should take a balanced diet, and we do not restrict you on not taking the proteins, because most of them say usikule nyama, usikunywe maziwa, which is not true. Because remember, we said that the cancer treatment is geared in destroying the cancer cells. Yes.
Yeah.
But as it destroys the cancer cells, you will find that some of the normal cells were destroyed. And that is why in cancer treatment, there's a lot of side effect. So now repairing of those destroyed normal cells, you will need proteins.
Okay.
So it just to urge anybody undergoing treatment for cancer, do not restrict yourself on what you should take and what you should not take.
Yeah, true.
Yes.
So speaking of what you should take and what you should not take, can we discuss the importance of follow-up or healthcare system as a patient now?
Yeah, it is very important. Even though you've been treated and you're certified, maybe cured, it's very important to continue with the treatment, since there's a chance that even though you're treated and cured, there's a chance of recurrence. And for example, something like breast cancer, we say having a breast cancer and having been treated for breast cancer on one breast predisposes you or makes the chances of having another cancer on the next breast high. Again, also it is important because some of the treatments that are given to one's cancer, although long-term, the chemotherapy, the radiotherapy, also have a long-term side effect that they can cause what we call secondary cancer. So it is very important. And also again, because you might be treated for a breast cancer, but probably you have malignancy elsewhere, or it metastasizes, or it moves from one place to another. So it's very important to continue with your follow-up. And some, like the hormonal positive breast cancers, there are some drugs that we give just to block the hormones and lower the risk of recurrence of the cancer. So we give them over years. And as long as you're taking medicine, it is good because of the side effect this medicine causes. You cannot just be taking medicines at home. You have to be followed up.
Oh,
yes.
No, that is great. Speaking of that, now after someone has been discovered, maybe they have this sickness, they have this cancer. Kwa akili ya mtu anakuanga ameweka cancer ni kifo. Most of the people out there, that is what they think. So how do you ensure that huyu mtu ame-embrace ama ameanza hizo treatment ama hajaamua kukufa tu hivyo? Like, you know people's mentality.
Yes,
how do you support their emotional state? Do you give a pre-advice, post-advice? What happens?
So in our setup, and what should actually occur in every setup is gentle conveying of the diagnosis.
Okay.
Because in my hospital where I work in Embu Level 5 hospital. If you're most of the times you'll be diagnosed with cancer, maybe in another department before now you're referred to us.
Okay.
But most of the time, especially if the person diagnosis has no counseling skills, or they do not convey the diagnosis to the patient themselves, rather they send them to us, where our counselors will sit with the patient and the relatives and be able to take them through and make them understand that cancer is not a death sentence. And we have patients that were treated for cancer in the 1990s, and we are still following them up. Those are like 20 years. So cancer, especially when diagnosed at an early stage, it is highly, highly curable. And most of them that are not curable, or those that are diagnosed at later stage, they are highly manageable. That is to mean as things like hypertension or diabetes, we know they are not curable, but you can live for them for years. So the same way, cancer, especially now that we have a lot of newer agents, the targeted therapy, the immunotherapy, they can really help.
Now, speaking of the advice, najua kuna kitu inawasumbua. You know what people believe in mostly? There's myths and misconception. Some contradict with the way you treat. Unapata hadi mtu wa follow up kulingana na maybe Kenya aliambiwa ama what they believe in. What are the common myths that contradict your work?
Okay, especially in our setup is people relying so much on religion, ama wanaenda kuombewa, which is not a bad thing, but then you should put in mind that God is the one that gave us the knowledge.
Yeah,
so
true.
If He didn't want us to know the medicines and to use the medicines, He wouldn't have given us the knowledge. So even as you continue with the prayers, it is important to continue with your medication. Yes, the other thing that I've seen is supplements. People opting for supplements with the hope, and those that sell those supplements are very good at marketing, where they promise that they will cure the cancer. So we've seen patients who default from treatment, but then come later when the disease has really grown. Again, then we've seen issues of witchcraft, where people believe that it is not normal, that I have been bewitched and that is why I got this. And so instead of seeking medical attention, they go kwa waganga.
Kuangalia the solution.
Yes. So those are some of the issues that really we see that we hope that our patients could listen, and even as they follow the alternative medicine, they follow this conventional medicine.
Maybe someone out there has grown an interest in maybe wanting to learn more about this or more about their body. How can they get to you?
I am located in Embu Level 5 Hospital. We have an oncology unit that is now fully functional. We offer chemotherapy, hormonotherapy. We also offer the screening services. Yeah, so you can visit us at the oncology unit in Embu Level 5.
Okay.
Yes.
Thank you very much. I loved the session, and I know our guests and our audiences out there, they loved the session, and we would really love to know more about this cancer. You know, ndio iko. Openly ndio iko.
Yes, it is
and
there.
And we need to know how to live with it, not to face it.
Yes.
So thank you very much, and I am so glad you're here.
You're welcome. Maybe my parting shot is to urge every woman, know your body. Kindly know your body, and if something does not feel right, go and seek medical attention. And still, if wherever you go to seek medical attention, you feel that you're not satisfied, you have the right to seek a second opinion. Yes.
Thank you very much. Thank you very much for keeping up, and I hope you have learned that your health comes first. So this is the Health Hub Show, and again, I am Nyambura Kamau. Don't forget, don't mismanage your money, don't mismanage your funds, because DreamWorks Investment Limited Company, they are the people you need at every time and every journey of your growth. So you have that building, you have that land, just give them a call and they will sort you out. So until next time.